Tuberculosis, or TB, is a serious infectious disease. It mainly affects the lungs. TB is caused by a bacterium called Mycobacterium tuberculosis. This bacterium spreads through the air. TB has plagued humanity for centuries. Despite its long history, TB remains a significant global health concern. Understanding TB, its causes, symptoms, treatment, and prevention is crucial in the fight against this disease. TB is often associated with poverty and overcrowding. However, anyone can get TB. It is important to be aware of the risks and take steps to protect ourselves and our communities. By understanding TB, we can work together to prevent its spread and ensure that those affected receive the care they need. TB is a global health problem. It affects millions of people each year. The World Health Organization, or WHO, estimates that 1/4 of the world's population has latent TB infection. TB is spread through the air. When a person with active TB coughs, sneezes, or talks, they release tiny droplets containing the bacteria. These droplets can stay suspended in the air for hours. People with weakened immune systems are more susceptible to TB. This includes individuals with HIV/AIDS, malnutrition, or diabetes. It also includes people undergoing chemotherapy or taking immunosuppressant drugs. TB is a curable disease. With early diagnosis and proper treatment, most people with TB can make a full recovery. Tuberculosis often develops gradually. Symptoms may not appear for weeks or even months after infection. It is important to recognize the signs and seek medical attention if you experience any of the following: a persistent cough that lasts for more than 3 weeks, chest pain, coughing up blood or sputum, also known as phlegm, weakness or fatigue, loss of appetite and weight loss, chills and night sweats, and fever. It is important to note that not everyone with TB will experience all of these symptoms. Some people may only have a few mild symptoms, while others may have more severe symptoms. Diagnosing tuberculosis is like solving a medical mystery. Because TB symptoms can be subtle and mimic other illnesses, healthcare providers rely on a combination of tools and investigations to confirm its presence. The first step is usually a thorough medical history and physical examination. Your doctor will ask about your symptoms, travel history, and any potential exposure to TB. A chest X-ray is often used to look for abnormalities in the lungs, such as nodules or cavities, which can be indicative of TB infection. The gold standard for diagnosing TB is a sputum test. This involves examining a sample of your phlegm under a microscope to identify the presence of Mycobacterium tuberculosis. In some cases, a tuberculin skin test, or TST, or a blood test called an interferon gamma release assay, or IgA, may be used to determine if you've been exposed to TB. Section 5. Treatment, a journey to recovery. Once diagnosed, treating tuberculosis is paramount to stopping its progression and preventing further transmission. Fortunately, TB is a curable disease, and effective treatment regimens are available. The standard treatment for TB typically involves a combination of antibiotics taken over a period of several months. The most common antibiotics used include isoniazid, rifampin, ethambutol, and pyrazinamide. Adhering to the prescribed medication regimen is crucial for successful treatment. Skipping doses or not completing the full course of antibiotics can lead to drug resistance, making TB much more difficult to treat. During treatment, it's essential to attend regular checkups with your healthcare provider to monitor your progress, manage any side effects, and ensure the effectiveness of the medication. Remember, while the journey to recovery may seem long, with proper treatment and support, you can overcome TB and regain your health. Section 6. Prevention, building barriers against TB. Preventing the spread of tuberculosis is a collective responsibility that requires a multi-pronged approach, encompassing individual actions, public health measures, and global cooperation. One of the most effective ways to prevent TB transmission is to identify and treat individuals with active TB disease promptly. By doing so, we break the chain of infection and protect others from exposure. Vaccination also plays a crucial role in TB prevention. The Bacillus Calmette-Guerin, or BCG vaccine, is administered to infants in many countries with a high prevalence of TB and has been shown to protect against severe forms of the disease. For individuals at high risk of TB infection, such as healthcare workers or those in close contact with someone with active TB, preventive therapy with antibiotics may be recommended. Section 7. The global fight against TB. Eradicating tuberculosis is a global health priority, requiring a concerted effort from governments, healthcare organizations, and individuals worldwide. The World Health Organization, or WHO, has set ambitious targets to end the global TB epidemic by 2030, aiming to reduce TB deaths by 90% and new cases by 80% compared to 2015 levels. Achieving these goals necessitates increased funding for TB research and development, improved access to diagnosis and treatment, and strengthened healthcare systems, particularly in low and middle-income countries where the burden of TB is highest. Public awareness campaigns and educational initiatives are essential to dispel myths and misconceptions surrounding TB, promote early detection and treatment-seeking behavior, and reduce stigma associated with the disease. Section 8. Conclusion. Our shared responsibility. Tuberculosis remains a formidable global health challenge, but it is a challenge we can overcome through knowledge, awareness, and collective action. By understanding the causes, symptoms, treatment, and prevention of TB, we can empower ourselves and our communities to combat this disease. Early diagnosis and treatment are paramount to improving outcomes for individuals with TB and preventing further transmission. If you experience any symptoms suggestive of TB, it is crucial to seek medical attention promptly. Let us work together to raise awareness about TB, support research efforts, and advocate for policies that promote access to quality healthcare for all. By joining forces, we can strive towards a world free from the burden of tuberculosis.